What are the factors affecting the posology? That means when a physician prescribe the medicines, when a physician prescribe the medicine to the particular patient, in that time, what are the parameters, what are the factors affect to the calculation of the dose? Okay, that means during the calculation of the dose for the particular patient, what are the parameters will be affect to that calculation of the dose? So what are the parameters will be affect? The first parameter is age and weight of the patient. Age and weight of the patient. Okay, and second one is the sex, and third one is tolerance, and next fourth one is simultaneously administered two or more drugs. What happened? Now one is synergistic effect, and another one is antagonistic effect. Antagonistic effect. Clear? And next one is severity of the disease. Severity of the disease. Okay, and next parameter is route of administration. Next one is the time of administration. And the next one is idiosyncrasy, and last one is allergy. Okay, so these are the parameters affect to the during the calculation of the dose. So first one is the age and weight of the patient. So first of all, you should know how the age and weight of the patient affect to the calculation of the dose. So before prescribing the medicine by the physician, so in their time, how the age and weight will be affect to the dose. So first point I am about age and weight of the patient. Okay. Achha. So all of you know कि person to person the physiological changes definitely will. Okay, person to person the physiological changes will be occurs. Okay, but a person I would a person of physiological when a change way. So simply you can say the pharmacokinetics changes the dose with the age. So what I'm telling, the pharmacokinetics changes the dose with the age. Age हिसाब रे pharmacokinetics कौन करे and dose को change करे दिए. So first of all you should know कि what do you mean by pharmacokinetics? Pharmacokinetics. Okay. So what do you mean by pharmacokinetics? Now pharmacokinetics means what? Now pharmacokinetics means what the body does to the drug. That means when you have to administer the drug, okay, when you have to administer the drug in that time, what is the role of the body? Or when the drug enters into the body in that time, what is the role of the body? Or what is the action of the body? Or what will be do the body? Body कौन करूँगी? What the function कौन? और body role कौन सी जगह रे? Now in that time, the body will do absorption, distribution, metabolism, and excretion. Simply you can say ADME process. Okay, ADME process. So simply you can say what do you mean by pharmacokinetics? Now pharmacokinetics means what the body does to the drug, or you can say to study about the ADME process inside the body. Clear? So how the pharmacokinetics changes the dose with the age. Kipari pharmacokinetics ଯଦି ଆମେ କହିବା absorption, distribution, metabolism and excretion କିପରି pharmacokinetics dose କୁ change କରିଦିଏ according to the age. Now first of all you should know कि what do you mean by absorption. Absorption means what? So that you can easily understand how the pharmacokinetics will changes the dose with the age. Okay. So first of all you should know what do you mean by absorption. Absorption means what? Or absorption of drugs means what? Now absorption means what? Now the drugs, the movement of the drug from site of application to the site of action. Okay. So what do you mean by site of action? Sorry, what do you mean by site of application? That means when you have to administer the paracetamol tablet in orally, that oral route is the site of application. Okay, and when the drug reaches to the system in circulation and shown therapeutic action, so that part is the site of action. Clear? So when the movement of drug from site of application to the site of action, that is called known as drug absorption. Clear? And second point is distribution. So what do you mean by distribution? Okay, now after reaching to the blood, okay, after reaching to the blood, the drug moves towards the cell, towards the tissue, or towards the various organ. So that is called known as distribution. Clear? And next one is the metabolism. So what do you mean by metabolism? Now metabolism means what? Metabolism means that is the chemical alteration of a drug. Okay, chemical alteration of a drug. So that is called known as metabolism. All of you know the metabolism in which organ or which organ helps for the metabolism? Liver. Liver is the organ that helps for the metabolism in your body systems. Clear? And what do you mean by excretion? What do you mean by excretion? Excretion means what? Excretion means the drug removed from the body. Okay, the drug removed from the body through the urination. That is the excretion. Okay, so first of all, you should know what do you mean by metabolism and what do you mean by excretion, so that you can easily understand how the pharmacokinetics parameter changes the dose with the age. Okay, so all of you know what do you mean by absorption, and all of you know what do you mean by distribution. And now again I am repeating that part, metabolism, because it is very important part, metabolism. Okay, so metabolism, what I am telling regarding the metabolism. Now metabolism, a organ is there. Okay, a organ is there, that organ helps for the metabolism. So which organ? And that is the liver. So simply you can say the liver is the check gate of our body system. Our body system or liver ta liver होची गोटे check gate. तो जहाँ भी तुम खाओ, जहाँ भी तुम नियो, फर्स्ट सेड से चेक करिवो. ओके, कि तुम कौन खाइछो, कौन नेइछो. So that's why liver is the check gate of our body systems. Clear? And the metabolism or the liver helps for the metabolism. Then you have to understand what do you mean by a fast pass metabolism. That is very important. Fast pass metabolism. Okay, so what do you mean by fast pass metabolism? Okay, so fast pass metabolism means what? Now after administration the drug, before going to the system in circulation, after administration the drug, before going to the system in circulation, the drug enters into the liver. The drug enters into the liver through the portal vein or through the portal circulation. Okay, for the metabolites. That is called known as fast pass metabolism. Okay, so what do you mean by fast pass metabolism? Now, what do you mean by fast pass metabolism? Now, after administration of the drug, before going to the system in circulation, the drug enters into the liver by the help of portal vein through a portal circulation for metabolites. That is called known as fast pass metabolism. So, what is the importance of the fast pass metabolism, or what is the importance of the fast pass metabolism to the calculation of the dose? Okay, so in the calculation of the dose, what is the importance of the fast pass metabolism? Yes, it is very important before calculation of the dose, because suppose you have to administer, suppose देखो, that is the stomach part, all of you know, and this one is small intestine. Okay, this is stomach part, this one is a small intestine, and this one is large intestine. Okay, clear? Achha. Suppose you have to administer the paracetamol tablet 500 mg. Okay, suppose you have to administer the paracetamol tablet 500 mg. So what will happen? Now all of you know what do you mean by fast pass metabolism? Simply, when you have to administer the paracetamol 500 mg, the drug enters into the body. The drug enters into the body, and before going to the system in circulation, that paracetamol 500 mg going to the liver. This part of liver thai going to the liver by the help of portal vein through the portal circulation for the metabolites. So in that liver, the 50% drugs get metabolized. Okay, So you have to administer 500 mg per stomach tablet. So due to fast pass metabolism, the 50% drugs get metabolized in the liver, and the rest, and that metabolized drug removed from your body through the stool or through the sweating, and the rest 50% drugs enters into the systemic circulation, and that amount of 50% drugs shown the therapeutic action. Okay, so simply you can say the 250 mg drug get metabolized and rest 250 mg drug enters into the systemic circulation for the showing the therapeutic action or for showing the pharmacological response. Clear? If the person having 25 years old, suppose what the patient age is 25 years old, okay, and that person requires 650 mg, okay. देखो, suppose that patient being 25 years old, and that 25 years old patient requires 650 mg of drug, 650 mg of drug. But in that case, you have to administer the 500 mg of paracetamol tablet. It requires 650 mg, but you have to administer 500 mg. So what will happen? Now, when you have to say same thing, when you have to administer the 500 mg of paracetamol tablet, due to fast pass metabolism, the 50% drugs get metabolized in the liver, and rest 250 mg of paracetamol tablet enters into the systemic circulation for the pharmacological response. But it requires 650 by 2, that is 325. But the 25 years patient requires the 325 mg drug for showing the proper therapeutic action. But in that time, administered, or but in that time 250 mg drug shown the therapeutic action, then definitely that 250 mg drug is not sufficient, is not capable for reduce the temperature, or for reduce the disease. So that's why before prescribing the medicine, first you have to check what is the age and what is your age weight of the patient. Okay, so according to the age, what will be happen? Now according to the age, the enzymes, some enzymes are present inside the liver, and that enzymes is sufficient, or that enzymes is vary from person to person according to the age. Some enzymes present inside the liver, and that enzyme, okay, that amount of enzyme helps for the metabolism. So that enzyme vary from person to person, or that enzyme varies from age to age. If the age of 19, then definitely in the liver, small amount of, or less amount of enzymes will be present, and that a less amount of enzyme is sufficient to metabolize the 500 mg, okay. But that enzyme is not sufficient, or is not capable to destruction or to metabolize the 650 mg of drugs. Clear? So that's why according to the age, the dose will be varied. So that's why the pharmacokinetics changes the dose with the age. Age हिसाब रे कौन हुए ना तारा मेटाबॉलिज्म चेंज हुए. तो मेटाबॉलिज्म चेंज होती माने कौन ना फास्ट पास मेटाबॉलिज्म ही जो कोई ड्रग रो फास्ट पास मेटाबॉलिज्म ही जो तो फास्ट पास मेटाबॉलिज्म में दाई किए ना एंजाइम्स, एंड दैट एंजाइम vary from age to age. जार एज अधिक तो जदि गोटे एडल्ट एज में जीवा तो एडल्ट एज रे कौन थाए ता लिवर रे मैक्सिमम अमाउंट ऑफ enzymes will be present, and that maximum amount of enzymes is sufficient to metabolize the higher amount of dose or higher amount of drugs. Clear? So that's why the pharmacokinetics changes the dose with the age. Clear? So in the children or in the old age patient, you have to administer the small amount of dose, but in the adult case, you have to administer the higher dose or the higher amount of drugs. So that's why age and weight of the patient is affect to the posology. Is a weight part जो रहिला weight मध्यम vary करे. According to the weight, the metabolism will be vary. Okay, according to the weight, some enzymes will be vary person to person. Clear? So that is the first part, age and weight of the patient, and that age and weight of the patient affect to the calculation of the dose. Clear? The second point is sex. Okay, so sex. So how the sex affect to the posology, or how the sex will affect to the calculation of the dose? Because in the male and woman case, okay, suppose I am giving the differentiate. Suppose I am giving one example regarding the differentiate between the male and woman. The main case रे जहाँ भी pharmacology response show करे ଗୋଟେ specific drug रो that specific action women case रे show करे नहीं. So what is the reason behind this? I am giving the same tablet. I am giving the same tablet. Suppose that is the A tablet. So I am giving the same tablet to the main person and to the woman person. But after administration, when the action will be shown, in that time definitely the action will be vary in men and woman case. Okay, men रे maximum action show करे, in woman case रे less action show करे. So the action will be vary from men to woman. Clear? So what is the reason behind this? Why in the woman I am giving the same medicine? So what is the reason behind the less therapeutic action will be shown? काहेकि less therapeutic action show goes reason कौन? I am giving the same medicine. So what is the reason behind this? That reason is some menstruation cycle, and pregnancy and lactation Okay, so if the patient suffering in the menstruation or during the menstruation, such type of medicines are there, that type of medicine were completely avoided during the menstruation cycle. Okay, जदि से केस रे जदि menstruation होउची, in that time you have to completely avoid for such type of medicine. So which type of medicines are completely avoid during the menstruation? Now that is, I am giving one example, that is aspirin, okay, and ibuprofen. Okay. These are the NSAID. These are the NSAID, that is the non-steroidal anti-inflammatory drug. Okay. During the menstruation, definitely severe stomach pain will be occurs. You should know. But I say time during the menstruation, what a lady with a conway na बहुत जोर stomach pain हुए. So to relieve the stomach pain, you have to administer the aceclofenac or diclofenac. Also, you have to administer the aspirin or ibuprofen. So why the aspirin or ibuprofen you have to completely avoid during the menstruation? Now yes, I know if the aspirin and ibuprofen, if you have to administer the aspirin and ibuprofen, definitely it reduces the relief pain. It reduces the severe pain. But why you can't administer? Because when you have to administer the aspirin, it is an NSAID, and also it is called as a blood thinner. It is also called as a blood thinner, and it prevents the clotting of blood. It prevents the blood clotting. So जदि माने in सही टाइम रे कौन हुए, जेहेतु से माने बहुत ब्लीडिंग हुए, you should know aspirin रो आउ गोटे एक्शन अछि कोन ना, it is also called as a blood thinner. आमे ताको blood thinner बोली मध्ये कहूचे, and it prevents the clotting of blood clot में से prevent करे. ता माने सही जगह से blood कौन करे ना बहुत thin करी दे, बहुत पतला करी दिए. That means less viscous. So that's why after administration the aspirin, the bleeding will be increases. Bleeding कौन ना, bleeding बढ़ी जाए, due to bleeding enhance करे, the bleeding will be increases ना due to aspirin or due to blood thinner. ये कौन ना, ये blood को thin कर दे, less कर दे और less viscous कर दे. That's why the bleeding will be enhanced in the patient. So that's why during the menstruation, completely avoid the aspirin and ibuprofen. Clear? And second thing is pregnancy. So during the pregnancy, also some medicines are there, and that medicines are completely avoided during the pregnancy. So what are the medicines are there? That medicines are, that is alcohol, barbiturates, okay, alcohol and barbiturates, and some narcotic drugs. Okay, so these are the drugs, and that drugs are completely avoid to the patient during the pregnancy. Okay, pregnancy jodi ke person अछि ba jodi ke lady pregnant अछि, in that time we are completely avoid such type of medicine, otherwise it affects to the, otherwise it hamper to the or affect to the lady. Clear? So what are the drugs? Now, alcohol, barbiturates, and some narcotic type of drugs. Clear? Then, so what is the reason behind this? Why the alcohol, barbiturates, and narcotic type of drugs are completely avoided during the pregnancy? Now, because it is affect to the, because it is affect to the fetus through the placenta, through the placenta, because such type of drugs affect to the fetus through the placenta. So placenta समझ जानी तो fetus कौन जो जगह रे बा जोटे हमर छुआटा रही थाए यूट्रस रे, जो छुआटा रही ताको कहा जाए ना fetus बोली कहा जाए, यूट्रस रे तो छुआटी रहे ताको fetus को बोली कहा जाए. That baby having the growth stage, से टाइम रे से कौन करना, से टाइम रे से growth stage रे थाए, तो माँ जहाँ भी किसी खाए तो से ठू से कौन करना, से दूसरे खाद्य को ऑब्जर्व करे, बस से दूसरे खाद्य को कलेक्ट करे. ओके, सो एंड प्लासेंटा, प्लासेंटा माने कौन ना, प्लासेंटा माने हो जे माने बेबी रो पेटर जो पाइप गोटे न्यारो पाइप जाई थाए, दैट इज द प्लासेंटा. सो थ्रू द प्लासेंटा the alcohol, barbiturate, narcotic type of drugs enters into the fetus, and definitely the fetus may be after birth, it may be abnormal babies due to narcotic, barbiturate, and alcohol type of drugs, because in that time their metabolism are completely, but in because in that time the metabolism part or the liver are completely and diminished. That's why the metabolism cannot be formed inside the fetus. So definitely the alcohol, barbiturates, and narcotic type of drugs directly affect to the fetus through the placenta. Then after born, the baby may be abnormal condition, or the baby may be abnormality. Okay, so that is the reason behind the avoid the alcohol, barbiturates, and narcotic type of drugs during the pregnancy. Clear? And next part is lactation. So lactation means what? All of you know lactation. Lactation means what? Now say time re, जो time re, वो baby का माँ जो खीरो नहीं था. Okay, so say time re, if you have to administer such type of medicine, then definitely that medicine directly enters into the baby. Okay, and definitely in their baby, okay, and definitely that baby are not eligible to metabolize such type of drugs. So जेहेतु से metabolism करी परिबनी, then definitely that drugs increases inside the body. Okay, जेहेतु a lactation थ्रू कौन हुए ना, that medicine directly enters into the baby, and in that time that baby is not eligible to metabolize such type of drugs, and definitely the drugs present inside the baby, and after some time or after some days it leads to the toxic effect inside the baby. So that's why some of the medicines are there, that medicine is completely prohibited or completely avoided during the lactation period. Okay, that's why before calculation the dose, the physician must be known whether it is suffering from menstruation cycle, or during the pregnancy or lactation. Then after that the physician prescribe, or after that the physician calculate the dose to the particular patient. Here, and next part is the tolerance. It is also a very important part, that is tolerance. Okay, so what do you mean by tolerance? Now tolerance, simply all of you know, or you can say, what do you mean by tolerance? Now tolerance means that is requirement of higher dose, to produce the given response. Okay, requirement of higher dose to produce the given response. So what do you mean that? The mane kono? That means suppose I am giving one example so that you can easily understand what do you mean by tolerance. Suppose tome first tome gym jaucho. So say time re kono hochi na in first day you have to take the 5 kg dumbbells. Okay, first day re tome kon karucho na 5 kg re dumbbells suda no uthaucho. And that is very difficult in that day. Man say time re tamo 5 kg dumbbells ko take up tamo difficult हुए. But after 10 days or after 20 days or after 1 month, after 1 month, that person takes 50 kg dumbbells. So how it is possible? And that person in the first day, it is very difficult to take the 5 kg dumbbell. But after some 10 days, 20 days, or 1 month, that particular person takes the 50 kg of dumbbell. So how it is possible? And due to the resistance inside the person. Say person bhitere kon na resistance create he jaiche. So that's why that body requires the higher amount of dumbbells. Okay, so that is the tolerance. That means when you have to administer repeatedly, okay, when you have to administer the drug repeatedly, repeatedly drug administer kari chalucho. When you have to administer the drug repeatedly, in that time the tolerance will be developed, or in that time when you have to administer the drug is repeatedly, in that time the higher amount of dose is required. Okay, the action when you have to administer the when you have to administer a drug is repeatedly, in that time the given response, or in that time the therapeutic action is completely diminished or abolished. So that's why in that time it requires the higher amount of dose to produce the given response, or to produce the such type of therapeutic action. Say same action to देखिए अपन ସେଇ ଜାଗାରେ ସେ require करे कौन ना higher amount of dose, because it is completely resistant to that particular medicine. Suppose I am giving the another example so that you can easily understand what I am telling regarding the tolerance. Suppose you have to administer the Cefixime 200 mg, okay, for bacterial infection. Suppose something say bacterial infection है, so to clear the bacterial infection you have to administer the antibiotic that is Cefixime 200 mg. But after administration 2 to 4 times, or after administration 5 days or 10 days, you will be marked medicine is not cure to our disease. A medicine more disease will cure kari par nahi. Then again you will come to the medicine, again you will come to the hospital, okay, and the physician in that time the physician prescribe to you clavum 625 mg. So why? So first the physician prescribe to you Cefixime 200 mg. So why the physician after some days you have why the physician after some days prescribe the clavum 625 mg? And because that is the higher antibiotic, and in that time the physician know about the tolerance, because say there are a patient janigala je that Cefixime 200 mg is completely resistant to your body, and that Cefixime 200 mg is not sufficient to kill the bacteria. So that's why in that time the physician prescribed to you clavum 625 mg. So that is the higher amount of antibiotics. Okay, so what do you mean by tolerance? Now tolerance means that is the requirement of higher dose to produce the given response. That means when you have to administer the drug is repeatedly, in that time the action or the therapeutic action is completely diminished or abolished. So in that time you have to administer the higher amount of dose to produce the given response. So same response को आउ थरे देखिबा पई सेटा तमे कोन करिवो ना, you have to take the higher amount of dose. So that is the tolerance. So before calculation the dose by the physician, in that time the physician check whether the Cefixime is eligible to kill the bacteria or not. If it requires the higher amount of dose, then in that time the physician prescribe the higher amount of dose due to tolerance effect. Clear? And next one is route of administration. Next one is route of Administration. So, what is route of administration, or how the route of administration affect to the posology? A posology route of administration can affect also. Now, all of you know. Simply, I am giving an example. That is IM. Sorry, that is oral route and IM route and IV route and subcutaneous route. Okay. So when you have to administer the paracetamol tablet, okay, so in which route you have to administer the paracetamol tablet? Now that is the oral route. So in oral route, you have to administer the paracetamol tablet, that is 650 mg, that is 500 mg or 650 mg. Okay, the paracetamol tablet 500 mg or 650 mg you have to administer in oral route. Okay, that is the tablet. So but in the case of IM means that is the intramuscular. In the IM route, if you have to administer some paracetamol injection, that is definitely less than the orally less than the tablet. Tablet તમે jaha bhi amount nature definitely ତାଠୁ କ'ଣ ହବ ନା less ହବ, that may be suppose 1 mg. Okay, if you have to administer the any type of medicines in through the IV route, that is the intravenous, then definitely you have to administer the less amount, that may be 0.5 mg. Okay, and in the subcutaneous, that is under the skin, you have to administer the drug under the skin. It is requires the higher amount of dose than the IM route. IM route अपेक्षा ये थ्री मोडलिटी डोज अधिक जीव. तो जब हम क्लारिफाई करिबा oral route, IM route and IV route, okay, the IV route is require the less amount of dose compared to the other dose. Why? Now because when you have to administer the dose or when you have to administer the drugs through the IV route or intravenous route, in that time the total amount of drug directly enters into the systemic circulation, and that amount of drugs shown the therapeutic action. Clear? But in the case of oral route, all of you know, because just I had discussed regarding the fast path metabolism. So what will happen? Now when you have to administer the 500 mg or 650 mg drug through the oral route, and definitely 50% drug get metabolized and rest 50% drugs going to the systemic circulation for showing the therapeutic action. And it's taking, and this route it takes the time taking. Okay, ये action show करिया पे ये बहुत time लिए. But in the IV route, that is the rapid action, because in the venous or in the vein, the blood will be circulate. So the drug directly enters into the systemic circulation. So the immediate therapeutic action. And in the IM route, first the drug will be absorbed in the muscle, then the drug enters into the systemic circulation. Definitely it requires the higher dose than the IV route dose. Here यहाँ पे ये मध्य आउट टिके माने dose require करो अधिक. Okay, and it is the time taking. Okay, so in the emergency case, maximum in the emergency case, the doctor or the physician prescribe the medicines, and that medicine you have to administer through the IV route. Why? Now because it takes the first thing, it takes the less amount of dose than the compared to the other drugs, and it takes the rapid absorption, and it is shown the immediate therapeutic action. Okay, so before calculation the dose, first the physician check whether the drug is administered through the oral route or whether the drug administered through the IM route or IV route or subcutaneous route. So according to the route of administration, the dose will be varied. Clear? Next one is time of administration. Time of administration. So how the time of administration affect the posology? Now some of the medicines are there, that medicines you can't administer in empty stomach, because all of you know the maximum drugs are absorbed in the small intestine. But those medicine you have to administer after meal. If the medicine you have to administer the before meal, as for example iron, aspirin, ibuprofen, so such type of medicine if you have to administer in empty stomach, Time of administration means in which time, that may be after a meal or that may be before meal. Okay, so if you have to administer such type of medicine in empty stomach, then definitely causes the irritation inside the stomach. ओके तुम जब एई टाइप ड्रग तुम कौन ना एई टाइप ड्रग तुम जब एम्प्टी स्टमक तुम नहीं जाइछ तो सच टाइप ऑफ ड्रग कॉजेस द इरिटेशन इनसाइड द stomach. Okay, so before calculation the dose, first you have to check in which route you have to administer. Clear? And next one is idiosyncrasy. Idiosyncrasy. Idiosyncrasy means what? Now, idiosyncrasy, that is the abnormal drug response of a drug. So, a drug or abnormal response, that means that is the unexpected response of a drug. It means after administration of the drug, you can't imagine, you can't think such type of response will become after administration to the particular patient. But तुम कभी imagine करी नथिबो कि एई टाइप रो response will show करिवो. That is the abnormality of the drug, or that is the unexpected response of a particular drug, and that idiosyncrasy that is vary from, or it is causes from the genetically. Okay, so that is called the idiosyncrasy. And last one is the allergy. Okay, if the patient having the allergic reaction, जदि गोटे patient allergic reaction सहित से यदि अछि, if the patient having suffering from allergic reaction, then in that time if you have to administer the penicillin, okay, penicillin is one of the antibiotic. Okay, if the patient or if the person having suffering from allergic reaction, if you have to administer the penicillin in that time, then definitely that penicillin enhance the anaphylactic shock, okay, inside the body. Okay, that means when if the patient having suffering from allergic reaction and if you have to administer the penicillin, so what will happen? Now it creates the anaphylactic shock inside the body. That means suddenly fall down the blood pressure inside the body. So before calculation the dose, first you have to check whether the patient is allergic reaction or not. Then you have to calculate the penicillin dose. Clear? And next one is the simultaneously. Last one is simultaneously administered two or more drugs. Okay. So when you have to calculate the dose, or when the physician calculate the dose, or when the physician prescribe the dose to the particular patient, in that time, if the physician prescribe two or more drugs simultaneously to the patient, so what will happen? Jodi gote patient दुई अधिक मेडिसिन टू और मोर मेडिसिन have to administer in simultaneously. एका थर जदि गोटे पेशेंट at a time दुई अधिक मेडिसिन से नौछि, so what is the problems arise regarding this? So many problems will be arise. One is synergistic effect. Another one is antagonistic effect. Okay, so there are two effects will become. One is synergistic effect, another one is the antagonistic effect. So first of all, you should know what do you mean by synergistic effect. Synergistic effect means what? I am giving one example so that you can easily understand when you have to administer the two or more drugs simultaneously. So what will be happen? Suppose a patient suffering from severity of pain or severe pain. Okay, in that time that person takes the aspirin. In that time the person administer the aspirin tablet, and all of you know the aspirin is the non-steroidal anti-inflammatory drug that used to kind of relieve the pain. Okay, you relieve the pain. So in that time, if the person again administer the alcohol, okay, if in that time, if that particular patient consuming some alcohol, because the person don't know what is the alternative action of the alcohol. Now yes, after administration the alcohol, it again reduce the pain inside the body. You should know, but the person to reduce the severity of the pain, the person administer the aspirin. Okay, and in that time again the person consuming the alcohol. So what will happen? And definitely, now when the action of drug increases or facilitated by the action of the another drug, that is called known as synergistic effect. So what do you mean by synergistic effect? Now when the action of one drug is increased by the another drug. So ଏଠି କଣ ହଉଛି ନା aspirin ର action ଯାହା ବି ଥିଲା ସେ ଆହୁରି କଣ ନା double ହେଇଯାଉଛି ନା due to consuming the alcohol. So definitely these are the two types of drugs. One is aspirin and alcohol. So in that time, the action of one drug or when the action of one drug is increased or facilitated by the action of another drug. Okay, so aspirin action is doubled by the or increased due to consuming the alcohol. So that is called known as synergistic effect when you have to administer the simultaneously two or more drugs. Next one is the antagonistic effect. So what do you mean by antagonistic effect or how the antagonistic effect affect to the posology? Suppose the person having suffering the blood pressure, okay, and decrease the blood pressure. Suppose a patient having suffering the decrease the blood pressure, and in that time the physician prescribed the patient you have to administer the noradrenaline. That noradrenaline is used to maintain the blood pressure or it is used to enhance the blood pressure. Clear? Okay. The person suffering from decrease the blood pressure. That's why the person administer the noradrenaline to maintain the blood pressure. And after some days, okay, after some days that medicine is continue. And after some days that patient have been suffering from diabetics. Okay. So in that time, you have to administer the other or diuretics medicines. But if the physician prescribe to the patient acetylcholine, okay, so in that time the physician prescribe the acetylcholine to control the urination. So what will be happen? Already that patient administered the noradrenaline to maintain the blood pressure, to enhance the blood pressure. Why? Now because due to reducing the blood pressure. And in that time, if the patient administered the acetylcholine, that acetylcholine also it is a neurotransmitter, and that acetylcholine again reduce the blood pressure. So the patient administer the noradrenaline for the enhancing the blood pressure, and the acetylcholine is again administered for the controls the urination, but it action another action is decrease the blood pressure. So that is the opposite action, and definitely when the action of one drug is abolished by the action of another drug, or when the action of one drug is abolished or diminished or decreased by the action of the another drug, that is called known as antagonism. So it is now first drug action decreased होउची बा diminished होउची और abolished होउची by the action of the another drug. ता माने इस जगह रे action कोन होउची ना zero ही जाउची. Why? Now because there are two opposite action of drug the patient administered simultaneously. Okay, so that is the antagonism. So these are the parameters or these are the factors affect to the posology.